Hi, and welcome to this edition of Mid-South Viewpoint here on Bot Radio Network. I'm Byron Tyler. So happy, friend, that you stopped by. Looking forward to introducing you to today's show. The Memphis Dental Society is very thrilled to once again bring the Mid-South Mission of Mercy to Memphis, and they've been doing that now. Drum roll, please. 10 years.
10 years, wow.
Dr. Mitchel Godat has been a faithful servant and organizer of this event. And it seems like each year this time, Mitch, we get together and talk about the upcoming one again at Bellevue Baptist Church.
Correct.
Friday, January 23rd, and Saturday, January 24th.
Correct.
Can you believe 10 years?
It's amazing. It's unbelievable, honestly. I can't believe that 10 years ago, we were just about to start this. 10 years ago, it was in February the first time. And then we moved it to the third week in January, or kind of the last weekend, because that was a better time to have it. And God's been good to us with weather for the most part and everything. And I've checked the weather up front, and as long as the meteorologists are correct and God is faithful still, which I'm sure He will be, the weather doesn't look like it's going to freeze or rain.
No snow plows.
No snow plows, no ice. Hopefully, looks like we're going to be okay. I constantly look at that, so looks like that's going to turn out okay. There's always something, Byron, that comes up every year that's a challenge. There's
Sure.
amazing things that happen. Miraculous stuff happens. I tell you, it's a lot of spiritual attack going on sometimes.
Well, when you look at things like, since 2016,
Yeah.
Mitch, over $12 million worth of dentistry to more than 16,000 patients.
Yep.
With more than 16,000 volunteers.
Right.
And
Amazing,
anytime
huh?
God's up to something, there's going to be attack, right?
There's going to be attack. The Bible tells us so, right?
Yeah.
That you're going to be attacked for Him, and it is it's tough some days. Practicing's tough, and putting this thing on is tough. Life's tough, right? Yeah. But God comes through. He helps us through it, and I'm just got to always remember that He's there to protect after us and look after us and help make things happen, like the Mission of Mercy. And I wanted to say too, Byron, that $12 million you're talking about, that's TennCare dollars. So if you take that and look at that in private practice dollars, that's like $30 million.
Oh my goodness!
In 9 years, because it's the 10th year. We haven't had the 10th year yet,
Exactly,
right? So
yeah.
that's in 9 years, $30 million, man. That's over $3 million a year
My goodness!
in free care to help
Wow.
help the Mid-South. It's a great opportunity to take care of people's health needs. We do free cleanings, extractions, and some fillings. And for a few people, they can maybe get a partial for that front tooth. And like a lady a few years ago, her name was Kim. She was missing a very front tooth. And Kim got her partial. And because every time she smiled, she always put her hand over her mouth. She brought her hand up as soon as she smiled. And then she said to herself, I guess I don't have to put my hand over my mouth anymore.
Wow!
Because I don't have to be embarrassed to smile.
Yes, beautiful.
Wow. And now she smiles.
My goodness!
What a story, huh?
That is a story.
Isn't that a story?
In what ways is oral health a critical component of our overall well-being? Because I think that gets overlooked.
Well, dentistry is a window into the body, right? Food goes in there, and we got to have teeth to chew, and that's part of our health. But decayed, rotten teeth can create abscesses, and some people end up in the hospital, Byron, and big infections. I saw a guy on the way over here end up in the hospital, unfortunately, because he didn't follow through on his dental needs, and he had 2 abscessed teeth. He became septic. They had put him on antibiotics, and dude, he almost died.
Oh my!
So yeah, so you got to take care of your mouth, because if you don't, it can kill you. Okay, now that thankfully doesn't happen every day, but
Yeah.
goodness gracious, please take care of your mouth and your dental health. We also know diabetes is a bigger problem when you have periodontal disease and decay, infection in the mouth. That increases your risk of making diabetes worse. Heart disease is worse. For us dudes, prostate cancer is a bigger problem when you have gum disease. Of all things, Alzheimer's disease may be instigated by some of the periodontal bacteria, the gum infection that goes on in the mouth. There's so much stuff we're learning every day. The last 50 years, we have learned so much about the health of the mouth and how it affects the rest of the body.
Yeah, and we don't talk about and think about those things.
No, we don't.
Really don't.
Yeah.
So any new advancements when addressing gingivitis?
So new advancements in our office, because I happen to be a periodontist
Yeah,
to treat gum
exactly.
disease.
That's why I asked you that
we have
question.
a laser we treat gum disease with today, which is amazing compared to old-fashioned surgery. called LANAP, and that's been around since the early 2000s, and we've done that. It's amazing. It's less discomfort for patients, and they still get healthy, and there's less shrinkage of the gums and that kind of stuff. So it's really cool things that we get to do in our practice to help people get rid of the bad breath and infection and make them healthier whole body and healthier in the mouth. They can smile and chew and enjoy life, and because that's what it's about. And then we can talk, right?
Yeah.
Yeah, talking's coming. And smile. Oh, my goodness, we can smile too. So yeah, we get to do some really amazing, great things. So
As many as 64.7 million American adults have mild, moderate, or severe gum disease.
Yeah.
How can I help prevent gum disease at home?
At home, so you can start with flossing and brushing and maybe irrigating, like using a water pick. We call that FBI in our practice, floss, brush, and irrigate, by the way. And the other thing is go see your dentist, because your dentist can diagnose periodontal gum disease, and make sure that when you see your dentist that they take x-rays and make sure they get out a periodontal probe and check for that. Okay, so at home there's some things you can do, but here's the thing, Byron. Flossing and brushing and irrigating can only clean 1, 2, and 3 millimeters below the gum line easily. The 4s and 5s maybe a little bit, but beyond that, the numbers are deeper than that. You can't clean it.
You can't clean it.
So you got to have a professional deep cleaning or the laser to fix it, or something has got to happen. And if you don't fix it, the teeth go bye-bye. Most adults lose their teeth not because of cavities, but because of gum disease. Okay, so then you're gumming it to death. Like, you got to wear the denture.
Yeah.
That's kind of hard to smile and eat with a denture in place. So,
Okay, so talk a little about systemic periodontist. No, I'm not saying that word right.
Systemic periodontitis can be where the gum disease affects the body. Okay, so we're having negative effects from the infection in the body. And if you look at somebody who has really severe periodontal disease that we can maybe still treat and help them keep their teeth, the amount of infection that's sitting in their mouth that may not hurt, by the way, is equivalent to the size of an ulcer on your forearm. If you had an ulcer on your forearm, you'd think something's wrong.
Yeah.
The thing is, you can't see in your mouth to see you have ulcerated infected gums. And that's how bacteria and toxins from that infection can get into your body, ooze into your body, and then make you more unhealthy with increased risk of diabetes, increased risk of heart disease, and a slew of other inflammatory diseases, because all those are about inflammation. We hear inflammation's bad for us, right? Okay. Now, here's the other thing that can happen. Other things in our body can affect our mouth too, okay? For example, sometimes a patient may come in and we treated them for a few years and they've been healthy, and all of a sudden they become not healthy in the mouth. We may go send them off to get checked for diabetes. And we may find out they're diabetic and they didn't know that. So we may have things that happen in the mouth that tell us that. Gastric reflux disease destroys the teeth. And you think, well, that's bad, it destroys the teeth, but gastric reflux disease can also greatly increase the risk of esophageal cancer or throat cancer. And a lot of times it's undiagnosed until it's really bad. So we may, in dentistry, find erosion on the teeth from the acid from gastric reflux disease. Until you go get that fixed, you don't get throat cancer.
Wow.
So, there are other things that we find in the mouth that may indicate other things going on in the body. Okay. Leukemia is another thing, okay, that we may find periodontal disease issues going on, but it may be related to leukemia, okay, of all things. So, it's crazy how everything's related. It's connected. After our body is connected to our head.
Yeah.
Right? And head connected to the body. So,
isn't it amazing? Of course, God uniquely created these bodies, and we need to be good keepers, and temple, maintenance needs to be done.
Right.
And oral health is the biggie that gets neglected so often. And that's one of the reasons. It's not just because people neglect.
Right.
We've talked about some of the issues when we're looking at under-resourced areas of our communities, and that's really been a big reason that the Mid-South Mission of Mercy has been such a blessing to so many people.
Absolutely. It's interesting when you look at Shelby County alone by itself and you look at where patients come from, because we look at that, and it's actually all over Shelby County. You might think, well, it's only people in downtown Memphis or southwest Memphis. It's people in Collierville. It's people in Eads and Germantown. So it's the whole community that is being served. But it's also the whole community serving those same people. So that's our beautiful thing to see that.
Yes.
Okay, that we're all helping each other out. And as we've talked many times before, I love I love the fact that a church, this is at Bellevue Baptist Church, they open their doors. They reduce our fees immensely by allowing us to destroy their entire gyms and fellowship hall for 2 days. So we really appreciate them. A shout out to them. And Ben Taylor, the pastor for missions out there, who helps us put this on. Ben's been there since the inception. Amazing guy. I know he's been on your show many times before too. But they allow us to use their gym and open up the doors to all these different kinds of people. To serve them. And, in the gym, you have volunteers that we know are believers, and we have ones that aren't believers, and we know they're Jews and Muslims and agnostics and atheists and whatnot. And then they're serving all those same people too, because we know there's patients in that same category and volunteers in the same category. And there's, as we mentioned many times, there's Democrats and Republicans and libertarians and non-political people all working together, and dentistry brought them together. To me, Byron, it's mind-boggling to think dentistry actually brought these people together, do some good, help people out. It shows there's still hope for mankind.
Yes.
And even as crazy as the world is with politics and this and that, we can still come together. And we may have a Palestinian helping a Jewish person. Wow. Or vice versa. That's really beautiful.
Isn't it beautiful?
Because you hear about how much they hate each other.
Yeah.
Right? We should, it's an opportunity to be together and not have hate.
Well, I think foundationally, when you look at serving together the community, and that's what we're doing through the Mid-South Mission of Mercy, and it's really a great thing. You think about, like you said, the volunteers alone. I mean, 16,000 volunteers over, and that's just overnight. That's not including
9 years.
That's not including the 10th year.
That's correct.
But you can add to that,
and it's 16,000 patients. So look at that. It's a 1-to-1.
1-to-1.
It's about one volunteer for every patient. And a lot of those volunteers, over half of them, are not dentists and not medical at all, because we need a whole lot of people to put this on.
Yeah.
I think there still might be a little room for some volunteers. So if you want to volunteer, you can sign up at midsouthmissionofmercy.org and go and volunteer there. We'd love to have you. You can also go under the patient information on the website or on Facebook or Instagram and find out about how you can be a patient there. It is first come, first serve. Get there early.
Yeah, and early. We're talking early.
Early, like Thursday for Friday. There's some people that get there at 6 o'clock on Thursday for Friday.
And they camp out.
Just like Black Friday on Thanksgiving, right? People do that.
Yeah, they do.
Make sure to bring, maybe a rain jacket because it might rain, and something to keep you warm, and maybe a little bit of food to eat.
Some water,
Some water would be good, just like you would if you're camping out for Thanksgiving, right?
Let's talk about implants, because I know that's another area of expertise that you do. Yeah. Who makes a good candidate for implants, and can my current dental health status exclude me from having implants?
Well, we can usually make you an implant candidate if your current dental health status is not good enough for that. So, for example, if you had gum disease, which we were talking about a few moments ago, we can treat the gum disease and get rid of that, because one of the number one reasons that implants do not work well is because someone has active gum disease in their mouth, or infection on a tooth, or needs a root canal or whatever. So first of all, our goal is to get the mouth healthy.
Yeah.
Okay. And then at the same time we get it healthy, or at a later time after it is healthy, then we can make you a candidate for implants. Okay. And some people don't have adequate foundation or bone for implants, and most of the time we can rebuild that as well too. So we can take somebody who's a dental cripple, Byron, they can't chew and smile, and their dentures flop around, or the partials flop around, or they have gaposis, meaning they have smile spaces and stuff. We can put implants in.
Yeah.
Okay? So a lot of great things we can do in dentistry. Yeah.
Are there implant scams that our folks need to be aware of?
Yeah, so as dental implants have grown as far as the industry, there's a lot of people placing implants. And, I think the thing is to determine, is someone really qualified to place implants? At least for us in our practice, all three of our doctors are board certified in periodontics and dental implant surgery. We've all taken additional training beyond dental school for 3 additional years. Some of that's hospital-based with sedation and learning how to graft and all those kind of things. They're all been around since 1969. Now, there's some people who just take a weekend course and learn to put implants in. Okay, so when you go, if you have somebody who's going to do an implant for you, you need to ask them, what's your training? How many hours of training have you had? Did you go to courses? Have you learned? How many hours do you have again of training? How many implants have you placed? We put in 33,000 implants in our office. We put in a few. We've learned a lot from that, and we say that in a humble way in that, everyone has complications. Is how can you deal with them?
Right.
Do you know how to deal with them?
Yeah.
We've dealt with a lot of those, so we typically can handle those.
What about financial? Because some people think, wow, it's just so cost absorbent. Is there a way to make implants more affordable?
Well, one way to make implants more affordable is to take every mouth so you don't need implants to begin with.
Yeah,
okay, so that would make it more affordable. Another thing you can do is you can go sometimes. The dental school has a lower fee than typically out in private practice, but it takes a lot more time to get treatment and care.
Sure.
Sometimes dental insurance may help cover some of those things.
But you don't want to compromise on the quality of material too, right? Is there different levels of implants?
Well, there are different types out there. We do not use the real cheapo implants that maybe have not been studied quite as well, this and that. We use a name brand that we know that's going to work well. It's tried and true and been studied very well. So we want to make sure we use really good materials, have good treatment plans. We have a three-dimensional x-ray that helps us to be able to map out the nerve and the amount of bone and look for other problems like infection and this type of thing, and do a real thorough exam to make sure the patient's healthy, for stuff. So if you do those types of things, you can rule out issues.
Okay. I'm experiencing tooth sensitivity. I'm worried about the color or look of a tooth.
Yeah.
Maybe have some type of dental pain. What's your best advice?
Well, that's a loaded question, and that could be a number of different problems. So sometimes when the tooth changes color, it could be decayed, and it's hurting because it's decayed and rotten, and it may need a root canal, or maybe it needs a filling and a crown. Maybe it needs to come out. Sometimes when the tooth changes colors because you have trauma in the past and the nerve inside the tooth's dead, and that makes the tooth change color. Sometimes the color change can be from coffee, wine, tea, Coca-Cola. All those things stain teeth too. So there are a lot of things that could stain teeth and then can make them hurt. You can have this thing called recession where the root's exposed, and then that can be very sensitive. So sometimes Sensodyne or some of those toothpaste may help out with that from a simple thing. If that doesn't help, then you need to go see your dentist to figure out what the problem is. And sometimes that might involve something in our office, which is gum grafting to fix a root that has recession. Sometimes it's as simple as putting some Sensodyne on it. And sometimes it may be the worst case scenario. It's time to say hasta la vista. Tooth's got to come out.
Gotta go.
Okay? It just depends. But the sooner you get and receive dental care, the less likely that's going to become more of a problem, more painful, more expensive, right? So the sooner we take care of stuff, whether it's medical or dental, we're more likely to be healthier and not suffer that. The thing I always hate, and we talk to patients sometimes, and they put stuff off.
Yes.
And I tell them, you can still call me on Saturday at midnight, but I'd rather you come in tomorrow or whatever, and let's take care of this problem now before it becomes an emergency. This is an urgency now.
Yes.
And sometimes they still call me at midnight.
Yes.
But we'd rather take care of it daytime.
Don't blame
when we're
you.
awake. But anyway.
Dr. Godat, with so many different kinds of toothbrushes that are on the market, you got electric, you got hard and soft bristles, deep cleaning, angled heads, bristle patterns. What do you recommend?
That is another loaded question. So first of all, I do not recommend a hard or medium bristle toothbrush. They sell them, and they're actually sold under cosmetics, and that's why they can sell them. If we actually looked at them as far as being a health device, they would not be able to be really sold because they create a lot of problems, the hard and soft bristles, because they tend to abrade the bone and gum away and even the tooth structure away. So we recommend a soft brush. We also recommend not to scrub back and forth because that can be bad for gums too. Honestly, the electric brushes out there are absolutely amazing. We do not recommend some of the electric brushes out there. One that I use personally that I recommend in my office is the Sonicare electric toothbrush. Don't scrub with it. It's got a soft bristle brush. It's got a timer for 2 minutes, which I think is really important because most people brush for 30 seconds, which is not long enough. And the bristles got to get along the gum line to clean them. So recommend to angle the bristles up for the upper teeth and down for the lower teeth. Again, don't scrub back and forth. If you can get an electric toothbrush, recommend that. Recommend to first floss, then brush, and then consider irrigation after that. That's like an irrigator or a water pick to use. So,
that's a good word. Okay, reflecting back over these past 10 years, what stands out to you most?
Every year, there's something that goes wrong. Even though there's great things, every year there's something that goes wrong. And every year, somehow, we still pull this thing off. Last year, we got in And somehow the compressor for the pediatric dentistry got lost.
Oh, my.
And this is on Thursday, about 1 o'clock. And the clinic opens at 6 a.m. on Friday.
Yeah.
Okay. Which again, it's first come, first serve. So don't get there at 6. You may not be seen. Thankfully, we called around and we got a compressor. Okay. And this year we know where the compressor is, by the way. We've already checked on that. So there are a lot of moving parts. Also, last year we had an issue with some of the x-rays, and we were going to maybe not get x-rays. And God came through, and we actually were able to purchase 5 x-ray units for $50,000, which normally costs probably a couple $100,000 for that. We had some donated by some wonderful dentists out there as well too. And now I'm proud to say we have 9 panoramic x-rays to take x-rays, so we can, and we actually own those now.
Really?
Yeah, and we own some other x-rays too to be able to take care of people. So we have to have x-rays to examine and make a diagnosis to be able to take care of people, so we can help them out.
Any unsung heroes behind the scenes? Are there any particular volunteers that stands out to you due to something unusual that has happened during these events?
Oh boy,
that we can give. There's probably multiple ones.
There's multiple. I mean, we could be here all day long and to the night, maybe tomorrow. So there's something every year. For example, one year we had inadvertently forgotten to have the T-shirts shipped from South Haven to Bellevue. And I happened to be looking out the window, and Dwight Lee. I'll shout out to Dwight Lee. He's
Dr. Lee's
husband. Yeah,
I grew up with Dr. Lee.
Did you really?
Yeah.
Small world.
We were neighbors.
Small world. Well, anyway, I happened to be looking out the window when I got the call that the T-shirts are not here, and I called the T-shirt place and you didn't have them delivered this year. I'm like, oh goodness. So I was looking out the window, and there's Dwight's truck with a 38-foot trailer on the back of it with nothing on it. And I'm on the phone. I said, hey, would a 38-foot trailer be able to transport all those T-shirts? And they said, probably. So I called Dwight up. I think I did a 3-way call with these T-shirt people, and he got down there and brought them to us. Okay. Last year, I'm totally forgetting who got the compressor last year, but we had somebody come up with the compressor last minute. They're amazing interpreters. We always need interpreters. So shout out if you can interpret, we need some for Friday morning.
Okay.
Early. Like 4 o'clock. Okay. Because we got to communicate to people, and we need interpreters. So you can sign up for being an interpreter at midsouthmissionofmercy.org. And so we've had some amazing interpreters like Mitzi, who helps out every year. She's been there since we started. She's awesome. Head of our interpreters. Without her, we couldn't do this.
Couldn't do it.
She does, and she's there at 3 a.m.
Wow.
To help us communicate. And I could go on and on and on.
It's exciting. It's so exciting, Mitchell. Yeah. It really is. So what has God taught you personally, having organized and served the Mid-South Mission of Mercy for these past 10 years?
You have to sit back and trust that people are going to do their thing, and it's going to happen. And trust Him.
Yeah.
The very first year, the question was, are we going to have enough patients show up? Are we going to have too many patients show up? Are we going to have enough money? Are we going to have enough volunteers? And He's provided that every year.
Every year.
And then something or some things every year miraculously happen. Things come together. I get stressed out about a lot of them still, but I've learned I've got to trust Him.
You do. We all have to trust Him.
We do.
Yes.
And the other thing is we've created an amazing network of people, through the Mission of Mercy, by people returning every year to do a lot of the same jobs that they've done. Or if somebody's not able to, like Miss Sharon Joyner, she's unable to be there this year and last year because of medical reasons. She'd help out in medical triage. Well, because she did such a good job, other people learned how to do her job. So they're able to fill in.
Wow.
Okay, so it's just neat to see how other people can see how someone else did this and then follow that and fill in to make things happen. So
wow.
It's just great.
Wow, praise God. Yeah. Okay, now if I wanted to volunteer as a dentist, would you require viewing my credentials before I start pulling teeth?
Absolutely. If not, you're in trouble. No, we do not. We look at no credentials. We're going to be on the honor system, and we're expecting you to, be outstanding, right? An upstanding, and you can sign up at midsouthmissionofmercy.org, and we still have some spots for dentists, okay, and interpreters, and we do a medical triage, Byron, of patients. So we have some physicians there. I think we may have a spot still open for physicians on a Friday afternoon and Saturday morning.
Medical assistants?
Medical, as in physicians, medical doctors.
No, I know you did doctors, but I'm talking about me, an assistant.
So we have physicians and family nurse practitioners, and we have nurses, and we have some of our clinical team that help to draw blood because we check to make sure people's diabetes is okay, their blood pressure is okay, because we got to have a safe person to work on. Right. So make sure to bring a list. If you're a patient, bring a list of your medications and medical problems so we know what's going on with you. So we do a medical triage, and then we do a dental triage to figure out what's wrong, an exam, right? Yeah. Take an x-ray and get the patient in to have a free filling, cleaning, or extraction. And then, as I mentioned, for a lucky few, they may get that partial like him we talked about earlier, so people can smile. And we are treating kids. And we have nitrous for the kids. Unfortunately, adults, no nitrous for you, so sorry. But the kids, we got nitrous or laughing gas for you to make it easy. And if you're coming, kids, you got to bring a legal guardian with you because we can't treat you without a legal guardian.
No, you can't do that.
It's very important. You got to have a legal guardian. And legal guardian if you're there. So if mom comes with the kid and mom wants some treatment, we got to have dad there too, or someone else who can watch the kids that's of 18 years of age or older, right? Because we have to keep
child care is not provided.
Child care is not provided,
No, it's not.
But we want to keep families together. We don't lose any families.
Exactly.
That would be bad. No families lost.
Well, it's the Mid-South Mission of Mercy, friend, and it's free dental care. That's right. I said free dental care. Friday, January 23rd, and Saturday, January 24th at Bellevue Baptist Church. As Dr. Godat said, you need to get there early. The line starts forming.
No tickets.
No.
First come, first serve. Okay, so get there early, because if you don't get there early enough, you may not be seen. And we want to be able to treat everybody that we can, and help them out with their most immediate dental need. And we may not be able to treat everything you need, but if not, because you're only there 2 days a year, we also want to get people to know that there's other places to get dentistry at reduced fees here in Memphis, like the dental school, Christ Community Health Service, Church Health Center, Concord Career College down the street. They do some cleanings there, and Delta State, and there's many other places.
Bellevue has a dental
and Bellevue has a mobile dental unit, which is being repaired right now, but they'll be open here at some point. So lots of other places throughout the year. For those other 363 days, because we're there for 2 of the 365 days, of course.
Dr. Godat, it is always my pleasure, friend, to have you stop by.
Thank you, Byron.
Mid-South Mission of Mercy, what's the website?
It is midsouthmissionofmercy.org. And let me share one more thing with you, if I might, Byron. This is our verse for the year. This is from Hebrews 13:16. And do not forget to do good and to share with others, for with such sacrifices God is pleased. So don't forget to do good and to share with others. And that's what we get to do at the Mid-South Mission of Mercy. So come join us, help us to do good, and share good with others.
Thank you, Mitch. Thanks for stopping by.
Thanks, Byron.
Well, friends, that's all the time we have on this edition of Mid-South Viewpoint here on Bott Radio Network. Thanks for stopping by. I'm Byron Tyler, and we'll talk to you next time. Bye-bye.